Do I seriously have to work today? It's a Monday, and I still haven't had my morning coffee. And you know what? Last episode, that one patient sued me.
We're rolling.
Hello, everyone. Welcome back to episode 256 of Mutated Me. I'm your favorite genetic counselor and host, Dr. Rachel Jeans, with a PhD in reality TV.
They're here.
Right. So this is our unique case, number 1234567J. So, hello, Tonya Jones, right?
Yes, that's me. But what's with the camera crew?
Oh, don't worry. We won't violate HIPAA.
Okay.
So I read your charts. You're 35 with no symptoms of HD, but can you elaborate a little more about why you're here?
Okay.
Look into the camera.
Okay. So I just found out that my dad has Huntington's disease, and so do I. So I'm kind of concerned if my daughters here might get it when they're older.
Wow. Did you get that? Nice. All right. So we're going to talk to you first about what exactly Huntington disease is. It's an inherited disease that over time will break down the nerve cells in your brain, and symptoms can range from not being able to control movements, loss of muscle. It can be difficult to think or process information, and you may not act the same way you do. Controlling your emotions can become difficult, and you can even have depression or anxiety.
What exactly does it affect in the body?
Well, it affects the central nervous system and the musculoskeletal system. The basal ganglia, which is in your brain, is responsible for moving, and the nerve cells around that structure start to die, which is what will lead to the symptoms.
So what is life like with the disease?
Well, the prognosis of HD is that symptoms usually get experienced around 30 or 40 years old, sometimes earlier, sometimes later, and those affected can expect to have difficulty moving, bodily changes, and a slow decline in cognitive function, and you might need someone to take care of you when you can no longer do things for yourself. And also, people normally have a 10 to 25 life expectancy after symptoms start to happen.
All right. Is there a medication I can take to slow it down?
Well, unfortunately, there is no cure, but there are treatment options to slow down the effects of the symptoms, such as physical therapy or medications like tetrabenazine for movement or mood-stabilizing drugs, such as Diprolix, as I have it written here.
Do they have any side effects? Because I want to take it right now if that's possible.
Well, every
If they have
medication
it.
usually has some sort of side effects. So tetrabenazine can have side effects ranging from nausea to bruising. Diprolix can have side effects from dizziness, hair loss, physical changes to the body. But when you experience the symptoms, we can sit down and talk about what's best for you.
Well, I think it's better to suffer through the side effects and a painful decline. But can you explain a little bit about how it's inherited exactly?
Well, yeah, I can use a Punnett square. It's this little diagram that shows the different combinations of genetics to see whether someone has a certain genotype, which is a certain genetic material. The uppercase H will represent the disease, and the lowercase h will be a normal gene. The reason for this is because Huntington disease is a dominant single gene disorder, meaning that it only needs one of the genes from either parent in order to be inherited, hence why it is uppercase. Now, if we cross the letters like how I'm doing here, we can see that the only way someone cannot inherit a disease is if neither parent has the dominant gene. In your case, your father had the dominant gene, so let's look over to this pedigree chart, another way to view the likelihood of inheriting diseases. This first generation is your mother and father. Dad is the square and mom is the circle. Dad has the disease, so we'll shade in dad. In the second generation, we have you. Dad's gene will be passed to you even if mom did not have the disease according to our Punnett square. So we'll shade you in, and there's your husband. Next are your children, and again, even though your husband doesn't have the inherited gene, you do. So we'll shade your children in. This shows that it's highly likely that they have inherited a disease.
But is this something that I should get them checked for right now or when they're older?
Well, I would recommend that you get them tested, as it would be greatly beneficial for them later in their lives. Also, people can exhibit symptoms really early on if they have juvenile Huntington disease. So would you like to hear the options you have?
Yes.
Okay, well, MRI scans or CT scans can show images of the brain to be analyzed to see if something isn't functioning properly, especially around the basal ganglia. Another option is a blood test where we can analyze the DNA for the HD mutation by counting certain repetitions of nucleotides, which are these little basic building blocks of the DNA. Well, your children are under 18, so testing is prohibited for that. But if you would like to screen for juvenile HD, that is possible, especially since your children are at risk.
Okay, yes, I would love that, but what are the implications?
Well, these tests can help you get a head start of the symptoms, so you can plan for the problems that they may have regarding your personal life. It can help you plan for in case you need a nurse of some kind later on. But it's completely up to you as their parent, but understand it can be a very heavy subject to discuss with young children, and there are some moral issues that you would be dealing with, such as knowing this information, and it can just be a really harsh reality. But also, if you don't want to know, that's okay, but you'd be living with this feeling of uncertainty and anxiety. So whether you go through with the testing or not, I will be here for you. For any questions or concerns you have, we can set up another appointment and see what you decide.
I know this is not going to be easy, but I do trust that you're going to be here with us, helping.
Now, thank you. So can you turn to the camera real quick and let them know about your experience here?
All right, so Dr. Jeans helped answer a lot of questions. I had a lot of nervousness coming in here. I did not know what I was going to expect, but you helped a lot. Thank you.
All right, well, that's it for today's episode. I'm your host, Dr. Rachel Jean. See you guys in the next one.